So the U.S. military should have the best doctors in the entire world. In a crisis, these are the medical professionals who are on the front lines. But unlike doctors who are at a really busy place like Mass General or Boston Medical Center, military doctors don't have a constant stream of service members with serious injuries coming in the front door. Now, it's a good thing that fewer service members are suffering serious injury, but it is also a problem for the doctors because it means they get less practice stitching people up or setting broken bones or doing emergency surgery to repair gunshot wounds. One of the key ways that military doctors and surgeons maintain their skills is by treating civilians at military treatment facilities, or MTFs. Now, Dr. Martinez-Lopez, how does DoD benefit from treating civilian patients?
Thank you very much, Senator. That's extremely important to us. The way, from the standpoint of readiness, we need to keep all the docs and all the nurses. It's not just the docs. It's a whole team that has to be sharp. By taking care of civilians, we do two things. One is the readiness piece, but also the good neighbor piece. I mean, like in San Antonio, if there is an emergency and they show up in our doorsteps, we have the good neighbor responsibility to provide good care to them too. But so we need to, as you said, we need to bring about more patients, especially trauma patients, and San Antonio is a perfect place where we do world-class burn care and also trauma care. And hopefully we'll never have to use those abroad, but if we do, our team will be ready to deploy and do that, right? So
we want you to be sharp, and we want you to have the chance to train as a team on an ongoing basis. We want you to be able to be designated as trauma centers because your level is that high in terms of your practice. In other words, treating civilians, for the military to treat civilians, is supposed to be a win-win. The civilian patient gets world-class care, and the military doctors stay up to date on their skills. It is not working out so well for patients. Most of them are dropped off at the MTF in an ambulance because they need emergency treatment, and the MTF is the best, closest option. 2/3 of civilians who end up at an MTF care do not have any insurance. The military treatment facility sticks these patients with massive bills, and if the cost isn't waived, federal law requires aggressive debt collection, including garnishing patients' wages or seizing tax refunds or even taking 15% of their Social Security checks before it even reaches their pockets. Now, the good news is the DoD now has authority to waive these debts. Dr. Martinez-Lopez, over the last 5 years, military treatment facilities treated almost 30,000 civilian emergency patients. For how many of those 30,000 patients did DoD exercise its authority to waive civilian medical debt, keeping in mind 2/3 of these folks do not have insurance?
Ma'am, a very small number, I think 57.
57, that's exactly right. 57 times DoD waived medical debt out of 30,000 people who came in and incurred these debts. So DoD is actually waiving debt, I tried to work this out, in about 0.2% of the cases. Now, DoD claimed that their number is low because waiver authority was too narrow, that the debt could only be waived if there was, quote, direct and compelling relationship to a priority DoD objective, not just that someone can't pay. So to address this problem, Representative Castro and I got an amendment into the 2021 NDAA, some of you remember this, to expand DoD's authority to waive medical bills. Our changes clarified that if medical treatment for civilians will enhance military medical readiness overall, and if the patient is unable to pay, DoD has legal authority just to tear up the bill. Dr. Martinez-Lopez, how often has DoD exercised this expanded authority to waive costs for civilians when the treatment will enhance readiness and the patient is unable to pay.
Ma'am, I don't know for sure, but I don't think we've done many, if any.
Yeah, so it kind of is looking like zero right now. Look, DOD is dragging its feet on while these patients are toppling into financial ruin. The GAO also found that DOD wasn't telling patients that they had an option for relief as required by DOD's own regulations, and they weren't properly tracking people when they had or had not paid their bills. So, Dr. Martinez-Lopez, on this new notion that we're really going to start holding people accountable in this committee, can I have your commitment that you're going to clean this up, start wiping out medical debts for civilians who shouldn't have been hit with those devastating bills to begin with, and you're going to get back to me on this?
Senator, I don't want to put more burden, and my colleagues are in the same boat, on patients that already have been traumatized. That's not what we're in. I mean, this, and worse, they cannot even pay. So why do we want to keep adding insult to many of those? So we thank you for this waiver. As I understand right now, we're stuck into the rulemaking. I've tried to figure out how can I expedite that rulemaking to give the solution set that you want and we want. So I commit that I'll work hard to get through the process in DOD and start, affecting in a nice way the patients that we care for.
I understand your heart is in the right place. I'm not quarreling with your heart. I got to have your actions in the right place. So I'm going to ask for the same thing that Senator Duckworth asked for. Can you get back to me in 4 weeks and at least lay out what the plan is to make certain that patients are fully informed about the opportunity to have their debts wiped out and what DOD's plan is to implement what we all worked to put into the law in 2021?
I will get back to you, ma'am.
4 weeks? Just to tell me what the plan is. I'm not even asking you for the final report. Tell me what the plan is.
I'll be glad to talk to your staff or yourself in 4 weeks.
Okay, we got it. Secretary Duckworth.